Sickle cell anemia. Sickle cell anemia is a genetic autosomal recessive hemoglobinopathy in which abnormal hemoglobin S causes RBC to assume a rigid crescent or sickle shape. That means in hemoglobin, there is a abnormal hemoglobin S. That means hemoglobin S will causes the RBC to form a shape of a sickle shape. Okay, and these sickle cells are less flexible, and what will happen, it will occlude the blood flow. We know that the blood is flowing through the blood vessel when usually the RBC size is in a circular shape, and when this RBC shape is turned into a shape of sickle, it can cause the occlusion of the blood flow through the blood vessel, and that condition is called vascular occlusion. Okay, so that means this sickle shaped RBC is less flexible as compared with the normal RBC. So what will happen, there is a dilution of the hemoglobin can happen, hemolysis, which can lead to chronic anemia. That means in a sickle cell anemia, there is a HB, the level will be lower than the normal requirement, which is mainly because of this H strand of the hemoglobin will cause sickle shaped. And by using one table, I will give an NCLEX focus theory on the sickle cell anemia. Okay. The first thing, the definition. We know that it is a autosomal recessive disorder. That means it is a genetic disorder. That means the hemoglobin S strand will lead to sickle shape RBC, which can lead to the hemolysis and the vasoocclusion. Okay, that means the main complication of the sickle cell disease is the vasoocclusive crisis. And here our NCLEX priority is to recognize the condition of the patient. That means if the client has a history of chronic anemia and something, it is the worsening condition, it is almost related to a sickle cell disease. Okay, and what are the common crises when the client is experiencing with sickle cell anemia? What are the common crises can be occurs in a patient with the sickle cell anemia? The first one crisis is the vasoocclusive crisis. That means we know that the RBC will turn into sickle form, so it will cause occlusion in the blood vessel, and that crisis is called vasoocclusive crisis. So we know that when there is an inadequate blood supply because of the vasoocclusion, which can lead to hypoxia. So when there is a hypoxia, the client will experience pain because of the ischemia. Okay. The second crisis is aplastic crisis. Aplastic crisis means here we know that because of the hemolysis, the client will experience severe anemia. Okay, and usually if the client is experiencing with any viral infection, for example parvovirus B19 infection, here the client will get a severe anemia. Okay, and here our priority is also we have to manage the pain, and we have to administer IV fluid to maintain the hydration status. We need to monitor the lab investigations and vital signs trends. Third one, sequestration crisis. In sequestration crisis, what happened mean, the sickle shaped RBC will trap by the spleen, which can lead to inadequate blood supply, finally hypovolemic shock. Fourth one, hyperhemolytic crisis. That means that because of the hemolysis, the rate of the hemolysis will get higher. That means there is a rapid destruction of the RBC. So when there is a RBC destruction, which can lead to anemia, and which can finally cause a crisis in the client, that is called hyperhemolytic crisis. So these are the main crisis which can be noted in a patient with sickle cell anemia. First one is vasoocclusive crisis, second one aplastic crisis, third one sequestration crisis, and last one hyperhemolytic crisis. We know that vasoocclusive crisis because of the sickle shaped RBC will occlude the blood flow, which can lead to hypoxia and pain in the patient. Second, in epileptic crisis, here the client will experience severe anemia, mainly because of the viral infections. In sequestration crisis, this RBC will trapped in the spleen, which can lead to shock in the patient, and hyperhemolytic, the client will experience a rapid destruction of the RBC, which leads to anemia. And our priority care, the priority assessment in the patient is usually we have to focus on the pain relief. We can administer the IV fluids to maintain the hydration, monitor the lab values to note down anemia. For example, we have to look for the hemoglobin level as well as the vital signs trend also. And next we can see what are the triggering factor in which the sickling of the RBC is triggered by some factors. And what are the triggering factors? The first one, hypoxia. That means inadequate blood supply leads to hypoxia. So this hypoxia can cause or trigger the rate of the RBC sickling. Okay. And next one is dehydration. Dehydration means when there is a dehydration, what will happen? Only the sickle shaped RBC will occlude the blood flow, and it can cause the inadequate blood supply leads to hypovolemia, and dehydration cannot. That means dehydration can worsen the condition of the sickling of the RBC. Okay. Next one, infection. For example, viral infection such as parvo virus B19 infection can also trigger the vaso-occlusive crisis. The next one, stress, acidosis, high altitude. Okay, when the client is moving into high altitude, when there is inadequate oxygen supply, which can cause hypoxia, which can trigger the sickling of the RBC, which will worsen the condition of the patient. And here we need to teach the patient as well as the family members to avoid the triggering factors. And last one, clinical signs. That means because of this sickling of the RBC, what are the possible clinical manifestations can be noted in a patient with sickle cell anemia? We know that here usually the hemolysis occurs, anemia can occur. So the client will experience all the symptoms of anemia. For example, fatigue, pallor, jaundice, pain. Pain, usually joint pain as well as abdominal pain. So here we need to assess the patient pain severity. We can use the pain scale 0 to 10. We can ask the patient how much pain the client is experiencing, and as well as the vital signs strength. Here we can look for the swelling of the hands or feet, fever, infections, leg ulcer because of this hypoxia, and the preoperative excessive sweating can be noted in a patient with the sickle cell crisis. And also we have to look for the infections. Main diagnostic evaluations are the hemoglobin electrophoresis. That means here we can understand the sickling of the RBC, or the HbS can be noted. Complete blood count, here we can look for the normal hemoglobin level, and if the client is having any infections, the client ESR rate will be higher, and reticulocyte count will get increases. Peripheral smear can be done, and also here when the spleen is trapping this RBC, which can cause some shock symptoms also. And the lab investigations, mainly we can look for the bilirubin, as well as we can screen the newborn also for finding out the symptoms of the sickle cell anemia. Here the NCLEX priority is to find out the abnormal values. That means we have to notice the hemoglobin value. We have to notice any lab investigation which suggestive of infections. And also whatever the findings are we are getting, we have to manage as early as possible to prevent further fatal conditions. What are the medical management if the client is experiencing with a sickle cell anemia? The main medications are hydroxyurea. Usually when the hemoglobin S is converted into sickling, here we can administer hydroxyurea. And also if the client is having chronic anemia, the client needs blood transfusions. And if the client is experiencing with severe pain, here we can administer opioid analgesics. We can, to combat with the infection, the client need to administer antibiotics and vaccinations to get prevention from some infections, and some bone marrow transplantation also. Bone marrow transplantation is the curative treatment the client with sickle cell anemia. Here our NCLEX focus is mainly we have to teach health education to the patient, and also the medication adherence also we need to give, and some engage the family to give care to the patient. And what are the nursing management? Nursing management mainly focusing, we know that because of the hypoxia the client will experience severe pain. So first focus is to manage or control the pain. Second, we need to administer IV fluids to maintain the hydration, because dehydration can trigger the sickling of the RBC. So here we need to administer IV fluids. Third one, oxygen therapy. That means if the client is oxygen saturation is lower than the normal, we know that the normal oxygen saturation level is 95 to 100%. If the oxygen saturation is less than 95%, we need to administer oxygen to the patient, and monitor the lab values, monitor the vital signs, and also here we need to give health education to the patient. That means to avoid the triggering factors, and to take adequate diet, and also the medication adherence, like that, and to free from infections, like that we have to give health education to the patient. In addition, we have to advise the client to take adequate water to maintain the hydration status. Okay, these are the main nursing management if we are giving care to a patient with sickle cell anemia. And next we can look for the what are the patient education can be given to a patient with sickle cell anemia. That means first thing, stay hydrated. We know that to maintain the hydration status, adequate water intake is needed. Second one, we can instruct the client to avoid some triggering factors like cold as well as stress. Okay, if anything, the symptoms such as pain, fever, anything is experienced by the client, it should need to be reported to the physician. And also always adherence with the medication. That means these medications need to be taken on a regular basis, and should not abruptly stop the medication without physician's order. And also we have the client needs to maintain a vaccination card, and here the client needs to look for the genetic counseling also. That means we know that the sickle cell anemia is a genetic disorder or autosomal recessive disorder also. Okay, always we have to understand, make the client understand about the importance of the treatment as well as the adherence of the medications. Okay, and here the mainly NCLEX tips for this sickle cell anemia. Mostly we have to look for the vaso-occlusive crisis. We know that because of the sickling of the RBC, it can trap in the blood vessel and can occlude the blood flow through the blood vessels. Okay, so what will happen here? The client will experience a vaso-occlusive pain, and also here the higher chances for getting infection. So the client need to take a proper vaccination, take medication such as antibiotic administration, and sometimes the client need to undergo for the splenic sequestration, because we know that the spleen will trap the sickled RBC, can lead to hypovolemic shock. Okay, then we have to manage for the pain, and also we can give health education to maintain a hydration status. We NCLEX focus or priority care always look for, first thing we have to look for the pain. That means we have to assess the severity of the pain. Second thing, to maintain the hydration status, the client need to take adequate intake of water. So if the client is hospitalized, we need to administer IV fluids. And we have to look or we have to monitor the client for infections, and what are the triggering factors it should be avoided by the client which can prevent the further sickling of the RBC so that the condition will get stabilized or managed. Hope you got an idea about the sickle cell anemia. Nothing that it is a autosomal recessive disorder. That means it can cause abnormal hemoglobin S formation, which can lead to sickling of the RBC. So when the RBC shape is converted into sickle shape, it can occlude the blood vessel. That means the vaso-occlusive crisis is the main complication can be noted in a sickle cell anemia. So our nurse's primary focus is to avoid the triggering factors, okay, and to give prompt care to the patient, manage the care. For example, we have to assess the pain, administer the IV fluids, remove the stress triggering factors. We give health education about this medication adherences, okay, and also we have to administer blood transfusion if the client is having chronic anemia, okay, and everything need to be immediately informed to the physicians. And also the client need to get a proper vaccination and also the medication adherence. And then we need to look for some warning signs of this crisis. For example, if the client is experiencing fever, sudden anemia, severe pain, shortness of breath, hypertension, splenic enlargement, these are the some warning signs or the emergency signs of the vaso-occlusive crisis. So here our focus of the management is to assess the pain and manage the pain, administer IV fluids immediately, administer blood transfusion if it is indicated. If the HP level is too low, the client can undergo for the blood transfusion, and we need to notify the provider. So this is a overall theory about the sickle cell anemia.